Welcome and taking part in the development of your country, your region, your province, your state, your city, your family, and your home. Who are new on my YouTube channel, please subscribe my channel, like live, and for feedback, write comments, and you can ask questions on today topic if you have any adopt today topic. Let's start today topic. Today topic. Today we will discuss about skeleton. Yesterday something was missing, and today we will complete today skeleton topic in detail. Let's start our topic skeleton. I continue the last topic. It was about cartilage. Com- Comparison of three types of cartilage. As you know, cartilage of three types: hyaline cartilage, fibrocartilage, elastic cartilage. We will discuss about their comparison, how these three types compare with each other. Welcome on my live. Please like and comment who are present. First we see hyaline cartilage, second fibrocartilage, and the third elastic cartilage. Location: hyaline cartilage in the articular cartilage of long bones, epiphyseal plates, nasal cartilage, thyroid, cricoid. Most of arterioid, trachea, bronchi, and costal cartilage. Location: while fibrocartilage is present in the intervertebral disc, interpubic disc of symphysis, pubis, articular disc of temporomandibular joints, TMJ, it is also called sternoclavicular joint, an inferior radio ulnar joint, articular cartilage of TMJ and sternoclavicular joint, while elastic cartilage is present in the pinna, sternal auditory meatus, eustachian tube, epiglottis, vocal process of arytenoid cartilage commiculate and commiform cartilage. Color: hyaline cartilage bluish white, fibrocartilage blistering white, while elastic cartilage yellowish. Appearance: hyaline cartilage shiny or translucent, fibrocartilage opaque, elastic cartilage also opaque. Fibers: very thin hyaline cartilage, very thin, having same refractive index as mattress, so these are not seen, while fibrocartilage numerous with fibers and fibrocartilage numerous yellow fibers. Elasticity: hyaline cartilage flexible, fibrocartilage more firm, strongest, while elastic cartilage most flexible. Perichondrium is present in hyaline cartilage and fibrocartilage absent, and elastic cartilage also present. Cells: in hyaline cartilage maximum, in fibrocartilage minimum, squeezed between fibers. In elastic cartilage moderate cells are present. Clinical anatomy: we discuss about some clinical cases. A defect in membranous ossification causes a rare syndrome called cleidocranial dysostosis. It is characterized by three cardinal features. Number one, varying degrees of aplasia of the clavicles. Number two, increase in the transverse diameter of cranium. Number three, retardation in fontanelle ossification. Srivastava et al. 1971. It may be hereditary or environmental in origin. A defect in endochondral ossification causes a common type of dwarfism called achondroplasia, in which the limbs are short but the trunk is normal. It is transmitted as a Mendelian dominant character. Periosteum is particularly sensitive to tearing or tension. Drilling into the compact bone without anesthesia causes only mild pain. or in etching sensation. Drilling into spongy bone is much more painful. Fractures, tumors, and infections of the bone are very painful. Blood supply of bone is so rich that it is very difficult to interrupt, interrupt it sufficiently to kill the bone. Causing a metal pin into the medullary cavity already interferes with the blood supply of the bone. Fracture is a break in the continuity of a bone. The fracture which is not connected with the skin wound is known as simple mean close fracture. The fracture line may be spiral or horizontal or oblique. The fracture with communi- communicates with the skin wound is known as compound or open fracture. A fracture requires reduction by which the alignment of the broken ends is restored. Healing repair of a fracture takes place in three stages. Number one, repair by granulation tissues. Number two, union by callus. Number three, consolidation by mature bone. Excess or second, cervical vertebrae may get fractures if dens of excess gets separated from the body as in hanging. It hits the vital centers and the medulla oblongata, causing instantaneous death. Even fracture of laminae may cause death. In retics deficiency of it is caused by deficiency of vitamin D, calcification of cartilage fails and ossification of the growth zone is disturbed. Retics affects the growing bones and therefore the disease develops during the period of most rapid growth of skeleton. And it takes that is due to deficiency of vitamin D, calcification of cartilage fails and ossification of the growth zone is disturbed. It takes affects the growing bones and therefore the disease develops during the period of most rapid growth of skeleton. For example, in 3 months to 3 years. Osteoid tissue is formed normally and the cartilage cells proliferate freely, but mineralization does not take place. This results in craniotabes, rachitic rosary at the costochondral junction, Harrison's sulcus at the diaphragmatic attachments, enlarged epiphysis in limb bones, and the spiral and pelvic deformities. For proper development of bones, a child requires adequate, adequate amounts of proteins, calcium, vitamin D. Deficiency of calcium and vitamin D in growing children lead, leads to widening of ends of bones with inadequate adequate ossification. This condition is called as ritis. In scurvy, that is due to deficiency of vitamin C. Formation of collagenous fibers and matrix is impaired. Defective formation of the intercellular cementing substances and lack of collagen cause rupture of capillaries and defective formation of new capillaries. Hematoma in the muscles and bones, subperiosteal pus, severe pain and tenderness. The normal architecture at the growing ends of the bone is lost. Many skeletal defects are caused by genetic factors or by a combination of genetic, hormonal, nutritional factors. The vertebral arch or laminae of the vertebral column are mostly normal. The spinal cord may be. The spinal cord may be covered just by skin, spina bifida, occulta. There may be protrusion of the meninges surrounding the spinal cord placed in the vertebral canal. Meningocele. There may be protrusion of the spinal cord as well as meninges, meningomyelocele, and deficiency of calcium and vitamin D occurs in adults' life. It leads osteomalacia. The bones, if deficiency of calcium and vitamin D occurs in adults' life, it leads osteomalacia. The bones on X-rays examination reveal thick, uncalcified osteoid. Osteoporosis shows thin and small trabeculae. There is a comparison between osteoporosis, and osteomalacia. Calcium and phosphate alkaline alkaline phosphatase osteoblast trabeculate. Osteoporosis normal, thin and small. Osteomalacia may be low, raised, increased, thick, uncalcified osteoid. Deficiency of calcium in bones is in old age leads to osteoporosis, seen both in females and males. Due to osteoporosis, there is forward bending of the vertebral column, leading to kyphosis. Nerves are closely related to bones in some areas. Fracture of the bones of those areas may lead to injury to the nerve, leading to paralysis of muscles supplied, including the sensory loss. Bone marrow biopsy. Bone marrow can be taken either from manubrium sternum or iliac crest in various clinical conditions. Bone tumor, benign or malignant tumors can occur in the bone. There are some important points that these should be remembered. Inorganic calcium salt is calcium hydroxyapatite Ca10PO4 6 OH hydroxide 2 is present in the bone. Femur is the longest and strongest bone in the body. Stapes of the middle ear is the shortest bone in the body. Three bony ossicles of middle ear are fully developed at birth. Hyoid bone, mandible, and three bony ossicles of middle ear develop from bronchial branchial cartilage. Fibula does not follow the law of ossification. Clavicle is a long, horizontally placed bone without the medullary cavity. Periosteum does not cover the sesamoid bones and the three bony ossicles of middle ear. Most common site of osteomyelitis is the metaphysis region of long bone. Bone marrow puncture is done in iliac crest in children and in manubrium sternum in adults. Bone fractures are seen more often in person without adequate protein, calcium and vitamin D. So we should be remember these things and we should not lose our protein calcium, and vitamin D. External ear or pinna is made of elastic cartilage. Its size does not increase even if it is pulled as part of punishment. जैसे टीचर हज़ार करते हैं, बच्चों का कान पकड़ लेते हैं, खींचते हैं, तो उसके करने से भी इसका जो है ना वो इंक्रीज़ नहीं होता. Elastic cartilage is present in epiglottis and vocal process of arytenoid cartilage. This cartilage does not calcify or ossify. Fibrocartilage gives strength to the site of its presence. It is chiefly present in midline joints. Hyaline cartilage is maximum in the body. All the somatic bones initially were composed of hyaline cartilage. Intramembranous ossification is quicker one-step process compared to intracartilaginous two-step process. Bones of the cranial vault are ossified by intramembranous ossification to quickly protect the developing brain. Let's we check our memory by multiple choice question MCQ. Number 1. What percentage of calcium of the body is stored in the bones? Answer will be given at the end. Please listen carefully. 90%, 80%, 97%, 75%. Proportional of inorganic matter to organic matter in the bones is 3 equal 3 to 1, 2 to 1, 1 to 1, 4 to 1. The cartilaginous model of bone arises from ectoderm, mesoderm, endoderm, neuroectoderm. Length of the bones increases by multiplication of cells at periosteum, epiphysis, epiphyseal plate, diaphysis. Ossification of long bones begins in intrauterine life at first week, 5th week, 8th week, 12th week. Which cartilage has no periosteum? Hyaline, elastic, white fibro, all of the above. The first bone to start ossify is mandible, femur, clavicle, humerus. Number 8. Which one is not a traction epiphysis? Lesser tubercle of humerus, greater trochanter of femur, head of humerus, lesser trochanter of femur. The answer is first MCQ answer is what percentage of calcium of the body is stored in the bones? Correct answer is 97%. Proportion of inorganic matter to organic matter and the bone is 3 to 1. The cartilaginous model of bone arises from mesoderm. Length of the bone increases by multiplication of cells at epiphyseal plate. These are correct answer. Ossification of long bones begins in intrauterine life at 8 week. Which cartilage has no which cartilage has no periosteum? White fibro. The first bone to start ossification is clavicle. Which one is not a traction epiphysis? The correct answer is head of humerus. So today our skeleton topic finished. Tomorrow, inshallah, we will start new topic joints. So we repeat again skeleton topic who are new, for those who are newcomer at our live lecture. Who are new, please write some comment. Skeleton includes bones and cartilage. It forms the main supporting framework of the body and is primarily designed for a more effective production of movements by the attached muscles. Bones. Synonyms. Bones has different name. One is os in Latin language. The other is osteon in Greek language. Compare with the terms osteology, ossification, osteomyelitis, osteomalacia, osteoma, osteotomy, etc. It is called what is bones. Bone is one third connective tissue. It is impregnated with calcium salts which constitute the remaining two-third part. The inorganic calcium salt, mainly calcium phosphate, partially calcium carbonate, and traces of other salts make it hard and rigid, which can afford resistance to compressive forces of weight bearing and impact forces of jumping. The organic connective tissue collagen fibers makes it tough and resilient, mean flexible. which can afford resistance to tensile forces. Instance, bone is comparable, comparable to iron and steel. The inorganic calcium salt is calcium hydroxyapatite. Chemically, it is indicate Ca10 PO4 6OH2. If it is removed by putting the bone in acid, what will be happen? Different interesting things will be come out. It becomes flexible and can be tied as a note, surgical note. If organic tissue is removed by burning, the bone crumbles into small pieces. Interesting things. Divisions of the skeletal system. Regions of the skeleton, number of bones, cranial and facial bones, mnemonic is A to Z. Exoskeleton is includes skull and the skull, cranium 8 bones, face, facial bone 14, hyoid 1, auditory ossicles 3 and each ear, total 6. Malleus, incus, stapes, vertebral column 26. And the thorax region, sternum 1 bone, ribs 24. Appendicular skeleton, pectoral or shoulder girders. Clavicle 2, scapula 2, upper extremities, humerus 2, ulna 2, radius 2, carpus 16 bone, metacarpus 10, phalanges 28, pelvic, hip girdle, pelvic or hip bones 2, lower extremities, femur 2 bones, fibula 2 bones, tibia 2 bones, patella 2 bones, tarsus 14, metatarsus 10, phalanges 26. Total bones in our body 206. Cranial and facial bones, ethmoid 1, frontal 1, inferior nasal concha 2, lacrimal 2, maxilla 2, mandible 1, nasal 2, occipital 1 bone, parietal 2 bone, palatine 2 bone, sphenoid 1 bone, temporal 2, vomer 1, zygomatic 2 bones. Despite its hardness and high calcium content, the bone is very much a living tissue. It is good. It is not a dead, it is a living tissue. It is highly vascular with a constant turnover of its calcium content. It shows a characteristic pattern of growth. It is subjected to disease and heals after a fracture. It has greater regenerative power than any other tissues of the body, except blood. It can mold itself according to changing and stress and strain it bears. It shows disuse it shows disuse atrophy and overuse hypertrophy. What are the function of bones? Bones gives shape and support to the body and resist any forms of stress. These provide surface for the attachment of muscles, tendons, ligaments, etc. These serves as levers for muscular actions. The skull, vertebral column, and thoracic cage protect brain, spinal cord, and thoracic and some abdominal viscera, respectively. Bone marrow manufactures blood cells. Bones store 97% of the body calcium and phosphorus. Bone marrow contains reticuloendothelial reticuloendothelial cells, which are phagocytic in nature and take part in immune response of the body. The larger paranasal air sinuses, for example, ethmoidal sinuses, affect the timbre of the voice. कौन कौन हमारी लाइव में है प्लीज़ कमेंट. Classification of bones according to shape. Long bones. Each long bone has an elongated shaft, diaphysis, and two expanding ends, epiphysis, which are smooth and articular. The shaft typically has three surfaces separated by three borders, a central medullary cavity, and a nutrient foramen directed away from the growing end. For example, typical long bones. These are humerus, radius, ulna, femur, tibia, and fibula, with two secondary epiphyses. Miniature or short bones have only one epiphysis like metacarpus and phalanges. Modified long bones have no modified long bones have no medullary cavity like clavicles. Short bones Their shape is usually cuboidal, like a cube, cube or scaphoid, boat shape. For example, tarsal and carpal bones. Flat bones resemble shallow plates and form boundaries of certain body cavities. For example, bones and the vault of the skull, sternum, ribs, and scapula. Irregular bones, for example, hip bones and bones and the base of the skull, for example, sphenoid and first and second cervical vertebra. Parametrous bones, certain irregular bones contain larger air spaces lined by epithelium. For example, maxilla, sphenoid, ethmoid. They make the skull light and weight, help and resonance of voice, and it is air conditioning chambers for the inspilled air. Sesamoid bones, these are bony modules found embedded in the tendons or joint capsules. They have no periosteum and ossify after birth. They are related to an articular or non-articular bony surface, and the surfaces of contact are covered with hyaline cartilage and lubricated by a bursa or synovial membrane. For example, patella and the tendon of quadriceps femoris, pisiform and the tendon of flexor carpi ulnaris, flabella and the tendon of lateral head of gastrocnemius radix bone developed and tendon of adductor longus in professional riders. Function of the sesamoid bones are: number one, to resist pressure, to minimize friction, to alter the direction of pull of the muscles, and to maintain the local circulation. Accessory supernumerary bones are not always present. These may occur as ununited epiphysis develops from extra centers of ossification. Examples: sutural bones of the skull, cervical ribs, lumbar ribs, The sutural or vermian bone is mostly seen in the region of lambda. These can be present at Asterian and Patarian as well. Such bones are common in hydrocephalic skulls. वो बच्चा जो पैदा होता है जिसका सारे त्रिभुज जितना होता है बड़ा. In medico-legal practice, accessory bones may be mistaken for fractures. However, these are often bilateral and have smooth surfaces without any callus. Developmental ossification. How bones develop. Membrane dermal bones ossify and membrane intramembranous or mesenchymal ossification and are thus derived from mesenchymal condensations. Examples, for example, bones of the vault of the skull like frontal, parietal, and facial bones like maxilla. Cartilaginous bones ossify and cartilage intracartilaginous or endochondral ossification and are thus derived from replacement of performed cartilaginous models. Five examples, bones of limbs like humerus, femur, vertebral column, and thoracic cage. Membrano-cartilaginous bones ossify partially and membrane and partially and cartilage. Examples are clavicle bone, sternal end ossifies by endochondral ossification while the rest of the bone ossifies by intramembranous ossification. Mandible, occipital, templar, sphenoid bones. Somatic bones. Most of the bones are somatic. Visceral bones, these are of few and develop from pharyngeal arches. Examples are hyoid bone, part of mandible, and ear ossicles. Regional classification. Axial skeleton includes skull, vertebral column, and thoracic cage. Appendicular skeleton includes bones of the limbs, for example, patellar girdle, free upper limb, and pelvic girdle. from low limb structural ossification. Macroscopically, the architecture of bone may be compact or cancellous. Compact number one, compact bone is dense and texture like ivory but is extremely porous. It is best developed in the cortex of the long bones. This is an adaptation to bending and twisting forces, a combination of compression, tension, and shear. Cancellous or spongy or trabecular bone is open in texture and is made up of a meshwork of trabeculi, rows, and plates, between which are marrow containing spaces. The trabecular meshwork are of three primary types. Number one, meshwork of rods. Number two, meshwork of rods and plates. Number three, meshworks of plates. Cancellous bone is an adaptation to compressive forces. Bones are marvelously constructed to combine strength, elasticity, and lightness and weight. Two, the architecture the architecture of bone may be modified by mechanical forces. The form of the bone is primarily determined by heredity. According to Wolff's law, trajectory theory of Wolff 1892, the bone formation is directly proportional to stress and strain. There are two forces, tensile force and compressive force. Both the tensile and compressive forces are stimulate bone formation in proper conditions. The architecture of cancellous bone is often interpreted in terms of the trajectorial tra- trajectorial theory. Thus, the arrangement of bony trabeculate Thus, the arrangement of bony trabeculate lamella is governed by the line of maximal internal stress and the bone. Pressure lamellae are arranged parallel to the line of weight transmission, whereas tension lamellae are arranged at right angle. Angles to pressure lamella. The compact arrangements of pressure lamellae forms bony buttress for additional support, like like calcal calcal femoral. Microscopically, the bone is of five types, namely lamellar, including both compact and cancellous cancellous bones, woven bones, fibrous bones, dentine, and cement. Lamellar bone, most of the mature human bones, whether compact or cancellous, are composed of thin plate of bony tissue called lamellae. These are arranged as branches, curved plates, and the cancellous bones, but in concentric cylinders. Harvin, Haversian syndrome or secondary osteon in a compact bone. Woven bone seen in fetal bones, fracture, repair, and in cancer of bone. The collagen fibers and bone crystals are arranged rando, randomly. randomly. Fibrous bone is found in young fetal bones but are common in reptiles and amphibia. Dentine and cement occur in teeth. These bones present in teeth. Gross structure of in adult long bone. Naked eye examination of the longitudinal and transverse sections of a long bone shows the following features. Number 1. Shaft. From without inward, it is composed of periosteum, cortex, and medullary cavity. How is life going on? Where are you from? Please introduce yourself. How are you? Everything's okay? Please introduce yourself. Where are you from? Who are present with us? Please comment so understand who are you, where are you from? Comment yourself, introduce yourself. Please comment, introduce yourself. Where are you from? Who is joined with us? Introduce yourself. Where are you from? Who is with us? I hope you are very well and doing something very well. Different doctors are here from different countries. Introduce yourself. Who is with us? What you like and anatomy? Write comment. Which topic you like? I hope all you are very well and happy in your places and taking part in the development of your country, your region, your province, your state, your city, your family, and your home. Who are new on my YouTube channel, please subscribe my channel, like, live, and for feedback, write comments, and you can ask question in the chat on to the topic if you have any doubt about to the topic. Today's topic was about skeleton in detail. My dear doctors, my friends, my students, my colleagues, scientists, researchers, physicians, scholars, medical staff, paramedical staff, my hospital maker staff, and who are know me and who not know me, and who are newcomers from different countries from all over the world on my YouTube channel live. I hope all you are very well and happy and working good for development of your country, your province, your region, your city, your state, your village, your family and your home. मैं उम्मीद करता हूँ आप लोगों को आज का जो टॉपिक था स्केलेटन के बारे में, बोन्स के बारे में बहुत अच्छी तरह समझ आ गया होगा। इसी तरह आप हमारे साथ जुड़े रहें। डेली हमारी यूट्यूब चैनल पे लाइव होती है। मेडिकल के डिफरेंट टॉपिक्स हम डिस्कस करते हैं। आजकल जो हम लेक्चर दे रहे हैं वो हैं अबाउट जनरल एनाटॉमी के बारे में, ह्यूमन बॉडी के मुख्तलिफ सिस्टम के बारे में, मुख्तलिफ पार्ट्स के बारे में। पहला जो लेक्चर था वो था इंट्रोडक्शन के ऊपर। जो सेकंड लेक्चर था वो भी स्केलेटन के बारे में था। और सेकंड लेक्चर जो था वो बेड साइड टेक्निक, हिस्ट्री टेकिंग के बारे में कि एक पेशेंट की हिस्ट्री किस तरह ली जाती है एज ए मेडिकल ऑफिसर, मेडिकल डॉक्टर, मेडिकल स्टूडेंट। इट इज़ अ ड्यूटी ऑफ टू टेक हिस्ट्री टेकिंग। हिस्ट्री टेकिंग के अंदर हम पेशेंट से मुख्तलिफ किस्म के क्वेश्चंस पूछते हैं, मुख्तलिफ किस्म की डिफरेंट किस्म की इंफॉर्मेशन लेते हैं। हिस्ट्री टेकिंग को डिवाइड कर देते हैं 2 पार्ट्स में, बायोडेटा और सेकंड पार्ट होता है मेडिकल डेटा और क्लिनिकल डेटा। तो इन सब के लिए ज़रूरी होता है कि आपको एनाटॉमी आनी चाहिए। एनाटॉमी की हमने डिस्कस किया था टुडे अबाउट स्केलेटन, बोन्स के बारे में, किस कहाँ बोन्स किस किस अमाउंट में पाई जाती है, कितनी नंबर्स में पाई जाती है। अपर लिम, लो लिम, हेड, नेक, थोरैक्स, पेवे गल्डर, ये सब हमने डिटेल में देखा था, पढ़ा था। बोन्स कौन कौन सी होती हैं, स्मॉल बोन, लॉन्ग बोन, कॉम्पैक्ट बोन, स्पॉन्जी बोन, सब चीज़ें हम ये देख चुके हैं। आई होप आपको ये सब चीज़ें अच्छी तरह से समझ आ गई होंगी। जो लोग हमारे चैनल पर न्यू हैं आप हमारे चैनल को सब्सक्राइब भी कर लें, बेल आइकॉन पे प्रेस भी कर दें और ख़ुद भी आया करें और अपने दोस्तों को भी, फ्रेंड्स को भी लाया करें। यहाँ मेडिकल के मुख्तलिफ टॉपिक्स डिस्कस किए जाएंगे। इट इज़ डॉक्टर अंसारी सीरीज़ ऑफ लेक्चर ऑन यूट्यूब। और आप कमेंट भी करें, आपको जिस टॉपिक पर लेक्चर चाहिए वो भी आपको प्रोवाइड किया जाएगा। डेली लेक्चर होते हैं 8 नाइट 10 to 12 or more. Introduce yourself. Where are you from? Write about yourself, something, what you do, where are you from, where you study, in which medical field you are study, or if you have job, where you do job, or you are medical student, where, in which college you study, in which year you are study, in which hospital you are doing work, in which hospital you are doing service for the welfare of patient and humanity. It does not matter how much you are busy, but take care yourself, your family, your parents, your neighbors, your friends, your students, and yourself also. Because the weather is summer, hot, hotness more, and give more water to old people like fathers and mothers, and advise them to drink water more and more to strong your bones. Also take vitamin D by foods and by sun rays, and vitamin C from citrus fruits, and also make habit of doing walk, morning walk and evening walk to get good health and save yourself from all kind of diseases. And the morning time, go in some park or in some garden under the tree, stand and do some exercise and take more deeply breathing for your good health and relax mind. In the morning time, there are so much pure oxygen around ourselves. Pure oxygen is mostly available in some park, in some garden, in some nursery, tree nursery, and also make habit to grow fruits, tree, medicinal plants to develop your family, and also plantation grow kitchen using things plant to get pure vegetables and pure raw material for the welfare of your family your children, your home members, and should also planted grow many fruits, many medicinal plants, so that you can develop your country, your family, your people, and the contribution of country development and save money, and also can export these medicinal plants, their raw material around other countries. For example, China, Indonesia, Malaysia, India, Pakistan. There is a big market into WHO and the world. So much growing herbal market, herbal medicinal plants or allopathic medicinal plants. It is more rapidly growing market. More than 20 millions dollars. The world is going to herbal medicine. They prefer to get cheap treatment. So you can also contribute in this category and make good money for your good future, for your family, for your children, for your parents, for your brother and sister. All the best. Good luck to you. Always happy, always smile. Make habit of drinking water 2 to 3 liters every day, and before breakfast 1 hour drink 2 cup or big glass of water or 500 ml only water to save yourself from different complication diseases and to overcome aging process, to bolster your memory, to save yourself from thrombosis, to save your kidney from accumulation of any stone particles, and yourself from blood diseases, and also to save yourself from heart problems. Okay, good luck. Thank you for joining my YouTube live. See you tomorrow, inshallah ta'ala. Come in our live with your friends. I hope you are very happy. Good night, sweet dreams.